Hey guys, it's Dr. Chris with Texas Chiro Health, coming back with our 12 minutes to health. So thank you guys for joining in. I really appreciate it. We're going to dig into some research here in just a second, but first, I just wanted to talk a little bit about why we do this at Texas Chiro Health. And I think for me, I started doing it. Well, one was because 2020 hit, right? And everyone was locked down and we weren't allowed to go anywhere. So this was a way that we could reach our patients and give them the research that they need, and not just our patients, but the community, so that we could help educate people on what the research says about eating better, moving more, and managing your stress. And that's, because that's what we're always talking about in the office, because that's what it takes to be healthy and to reach homeostasis, keep our cells healthy, keep our bodies healthy. So I wanted to be able to get the research out, because we would hand out the research in the office and we would go out and do community talks and things. But the 12 minutes to health became a great way that we could reach more people through, Zoom calls and social media and our in-office stuff that we do on Tuesday nights. So so that's where the 12 minutes of health got started for us. So I thank you guys that have joined in and continue to join in to see what the research actually has to say. It's a big part of what we do in our clinic is education, not only of ourselves by finding research and analyzing it, but then getting it to our patients so that you guys have the answers that you need and that you deserve when it comes to being healthy. So that's just a little bit of a background. I don't think I've ever gone into that with you guys. I just wanted to let you know where it came from and why we do it. So looking at today's article, this peer-reviewed literature done by Dr. Stephen Levine is on the importance of a balanced approach to vitamin D supplementation. And this is a huge study because he looked at all the vitamin D stuff. He looked at all the fat-soluble vitamins, right? A, D, E, and K. And he noticed a couple of things. He noticed that, one, they act more like hormones, most of them, and two, that they all work together, and it's important that we have balance between them. Specifically, A and D is what he focused on in this article. But he also noticed that we take a very limited approach to not just research, but to our health. Our pharmacological approach is, one ingredient, one molecule, one medicine, whatever it is for one symptom, or maybe for a couple of different symptoms, but it's this one-on-one thing, and it's just not how nutrition works for us. It's not how we evolve. So he looked at, how do these things work together? And part of the reason he did it is because of, I'll talk about a functional deficiency in just a minute, but he noticed that there was a study done with calcium and vitamin D, and they were just looking at bone health. And he read the study, and one of the conclusions that could have been drawn from the study is that vitamin D has nothing to do with bone health, because they put them together, D and calcium, and bones got stronger and there were less fractures and things. Well, they did it with just vitamin D in a different study, and it didn't have the same results. And that's because D and calcium were working together to create the results. Calcium didn't do it by itself either. So he noticed that, if we would have just studied these separately, we would think they have no effect on bone health when they have a drastic effect on bone health when they're put together. So that's why he started studying these things in balance and looking at these vitamins. Another thing he noticed about the fat-soluble vitamins is through the research that's come out recently, he says that they are very powerful antioxidants, and it's part of the way that vitamin D plays into cancer prevention. And vitamin A as well, which you'll see. So really important study, because when we look at our bodies, everything's working in balance, right? It's not these isolated situations. There's many factors that play into this stuff. So this is just one example of that. The way that vitamin A and vitamin D work together is through the RXR receptor. So basically A and D share this receptor in our bodies, and this is on every single cell that we have. There's a RXR receptor that vitamin A and vitamin D share. Now they have their own separate receptors, but they come together on this one, right? And that allows them to work synergistically, or what they said in this study is that they crosstalk to each other. Now the crosstalk thing was actually thought of as being bad at first, but what we found out is that by looking at the physiology and everything, that they're actually enhancing each other, and that you could have appropriate levels of vitamin D in your blood, right? Your blood levels when we're measuring it, But if you don't have that balance with vitamin A, that D's not getting used as much as it could or should, and it'll start to store in the fat. So a lot of people ask me, because all of our patients take a vitamin D supplement. It's in our omega, and I'll talk more about that later. But they ask, well, can't vitamin D be dangerous? Can't you have toxic levels of it? And the answer is yes, it can, but it's very unlikely if you're doing it correctly. If you have enough vitamin A, because all your vitamin D is then getting used, it's not just storing in your fat. And it takes a long, long time for it to fill up your adipose tissue or your fat cells, right? So vitamin D, when taken at really high doses for a long period of time, which isn't beneficial for you, the high dose thing either, which I'll talk about, but for over a long period of time like that, it could become toxic. But none of our patients or the people that we talk to or the people that are watching this ever have to worry about that. So doing it correctly and making sure that it's balanced with vitamin A is very, very important because of this synergistic effect through the RXR receptor. They think that vitamin K may also share the RXR receptor to a degree. He mentioned that in this article. So that's why vitamin K and vitamin D work synergistically in things like protecting our kidneys and also in bone health as well. So that's a pretty cool finding in the study, that they all kind of work together and we need to keep them balanced. When we don't keep them balanced, we create what is called a functional deficiency. So I was talking a little bit about this earlier, but let's say you have the correct vitamin D levels in your blood, but you don't have enough vitamin A. You're not going to maximize that vitamin D. It's functionally, you're going to function like you're at a deficit, as though there wasn't enough of it in your blood, but there is. The only issue is we don't have enough vitamin A so that they can work synergistically and get the maximum benefit out of both of them. And when they started looking at it, they said, well, what's the right balance, right? And it occurs naturally in cod. This is a picture of a cod, right? So cod liver oil is a big deal when it comes to A and D occurring in their natural amounts that they should be. And there's still confusion out there about what the appropriate levels of vitamin D should be. And it varies for different things. If we're talking about bone health, or if we're talking about, preventing rickets, which is the only thing we thought it did for a long time, or if we're talking about osteoporosis. And then we also need to know how much calcium do you need. So there's a lot to it, and we need to look at those balances that are occurring in nature that we used to get readily as we were evolving. So cod liver oil is where you'll find a natural balance between vitamin A and vitamin D. And they just found that out by chance, actually, through some different experiments that they were doing trying to isolate vitamin A. Because a lot of times we get vitamin A from what are called carotenoids, but they figured out that about half the population can't make that conversion happen from carotenoids to vitamin A. Right? So they said, okay, well, where does vitamin A just occur by itself naturally? And we found it in cod liver oil, and then noticed that D was with it, and that all kind of led to this study. So we've got to have that naturally occurring balance of A and D. When these two are in balance, they've shown in these studies that it helps in cancer prevention, that it helps with heart disease, that it helps with the liver detoxification and liver disease as well. And then, of course, it gives you strong bones from the vitamin D and the vitamin A balance, and also calcium's in there. There are other things that play into it, but that's the whole point of this study, is let's take a look at some of these things working together and see why that's important. So vitamin D, guys, for breast cancer, for prostate cancer, it's colon cancer. The latest study I just read was on colon cancer. And some of these things, when we get appropriate levels of vitamin D, it's cutting in more than in half the rate of cancer. This study showed with leukemia, I believe it was leukemia, I'm pretty sure it was, yeah, that vitamin A actually has the ability to make leukemia cells non-cancerous. It can turn them into a non-cancerous cell. So, but we have to have that balance of vitamin A and vitamin D, and that's why it's so important that we do it together. Some of these studies they've done where they just isolate vitamin D, they're still getting results because it is working. It's just not working. It's not providing the maximum benefit that it could be, and that's why what our blood levels are sometimes thrown off. We get different, like, it needs to be 50 nanograms per deciliter, it needs to be 32, or whatever the most recent research is saying. Well, that's also being based on the fact we don't have vitamin A in there at a regular balance, or we're at least not studying it that way, so we're not sure on that maximum benefit. So when you put the two together, you start to see that maximum benefit because they're working synergistically and doing the cross-talking that I was talking about earlier. So that's very, very important. In our office, we use a combined supplement. So Innate Choice is a company that is developed up in Canada, and they used to have vitamin D, but because of this research, really, and that's what turned me onto this research, was this company, they combine cod liver oil with their omega-3 fish oil, so that not only do you get vitamin A and vitamin D in the naturally occurring correct amounts from an organic source, you also get your omega-3s, the appropriate amount of omega-3s, in this one supplement. And this one supplement costs about $2 a day. And we're preventing cancers and all sorts of other things that the research is showing us that we need to have these things in the right balances every day in our life. And I say every day because the research is very clear on vitamin D that when we do huge doses, I've talked about this before, like bolus doses of vitamin D, we do not see a benefit. In fact, we see even less benefit from big doses than we do not using it at all. Or using it appropriately, where we see maximum benefit is when we take a certain amount, 4,000 to 5,000 IUs a day, every single day. So we keep that low amount so that we can raise our blood levels to the appropriate levels. And with vitamin A being there, we get the maximum benefit from vitamin D, and it's just a win-win situation for $2 a day. I mean, it's why every single patient that we have come into the office is put on this supplement, because we are all deficient in this stuff because of our modern lifestyle, because of how food is grown, and pesticides, and the list goes on and on and on. But we just don't eat the same way we used to. So we put all of our patients on this and a probiotic bacteria so that they can get our 3 main essential nutrients, or 4 really, I guess, with the A, D, and then the omega-3s and the probiotic bacteria. So hugely important that you guys are taking this every single day so you can see maximum benefit and get to homeostasis and just be as healthy as you can. So I know there's questions, right? That's why we do these talks throughout the community. That's why I do them every Tuesday night at 5:15 in the office. Get into the office and get your questions answered, guys. And if you're having some issues, you don't feel as healthy as you should, you have some aches and pains, headaches, whatever it may be, then take advantage of this offer. It's just a $39 donation to our local monthly charity, and that gets your exam, consultation, x-rays. We use our spinal health assessment, which is the proprietary software created by the same company that created the supplements. And it gives you a health score. It looks at your whole lifestyle, and it gives you a health score from 1 to 100, so we can figure out what's going on and how to take care of it. And we bring that price all the way down, guys, so that people stop making excuses. It's time or money, right? Those two things are always there. And we need to take care of ourselves. So this doesn't take long. It's about a 45-minute trip to the office to get all this stuff done, and then we'll let you know what we found and how we can help you out. So come on in, get it done, stop in and see us. And either way, come in Tuesday nights at 5:15 into the offices so you can meet the doctors and get your questions answered. Thanks, guys. I'll see you next time.